right, hey YouTube. Well, today I have the privilege of introducing one of my good friends, Dr. Bobby Mansouri from down in Texas. He's a dermatologist resident.
Hey YouTube, how's it going?
All right, well, Bobby, thank you so much for being here with us today. I just wanted to see if you could tell us just a little bit about yourself to begin with.
Sure, I'm originally from Lubbock, Texas, which is in the panhandle of Texas. Grew up there, had a great time. I stayed there for college, which was at Texas Tech University. And then when I went to med school, I ended up going to Duke University's School of Medicine in Durham, North Carolina. Um, During my time there, I spent a year at the National Institutes of Health doing a clinical research fellowship, and then came back to Durham to finish med school. Ended up matching into radiology residency first, which came with a separate intern year that I did at Pittsburgh. And then I went to San Francisco to do a little bit of radiology, and then I decided I wanted to change in life, so moved down to Dallas to do a dermatology research fellowship, and now I'm in dermatology residency. So
So that was a pretty big change going from radiology to dermatology. What made you decide that?
yeah, it was a pretty big change. I think really the biggest thing about the change for me was patient care. Um, when I was in medical school, and I think a lot of people run into this in medical school, particularly if you go right from your college years into med school and you don't have like a gap year in between. I think I probably got a little. And so when I was deciding which specialty I wanted to do in med school, radiology seemed like a good choice because, you know, it basically seemed like you hang out in a room and look at pictures and drink coffee all day, which seemed cool to me at the time. Um, but then once you start your intern year and you really feel like, you're someone's physician and you're helping people, I think for me, stepping back from that and no longer being directly involved in patient care, it wasn't something that I wanted to do long term. So I sort of weighed my options and decided that dermatology was a good fit.
Nice. Well, that's great, Bobby. I'm so proud that you've been able to make that transition, and now that you're into a field that you love doing. I see all your Instagram pictures, and it looks like you're just loving the life of a dermatologist. Okay, so, Bobby, could you tell us what the daily life of a dermatologist is like?
Sure. So, yeah, I can go through daily life of a dermatology resident and then a dermatologist a little bit from what I know. Um, so, in terms of being a dermatology resident, it's probably one of the better residencies in terms of hours actually spent at work. So, our typical schedule is pretty much 8 to 5 in clinic. Clinical duties involve either seeing clinic patients, so it's just your typical outpatient clinic where you're seeing patients pretty quickly and helping people with their problems. The additional things that you get to do in dermatology during the day are you could be doing some type of surgery, either skin excisions of skin cancers or other benign skin tumors, or Mohs surgery, which is a specialized type of skin surgery, typically on the head and neck. Um, and then the other part of dermatology is that a lot of people get interested in dermatopathology, so like histology of skin and skin diseases. And we do that a fair bit during residency. And if you want to sort of train specifically in that, there is fellowship for it. So that's also sometimes mixed into our schedule. Uh, in terms of residency, what we don't do during the day as clinical duties, we certainly make up for at nighttime and on weekends because there's a lot of studying that goes into being a dermatology resident sort of outside of work. Because you really, as a specialist, have to know sort of a lot of minutia of skin diseases, which you may or may not ever see in your life, but people are, sending you these patients for your specialized expertise, so it's important to know sort of the very rare instances of skin disease. In terms of being a dermatologist in general, dermatologists work between 4 and 5 days a week in general, and you know make, I guess, decent money. And those are the types of things I think a lot of people think about when they're choosing a specialty, not only what residency is going to be like, but also what it would be like to be a practicing physician. And in general, dermatologists are very, very happy with what they do. It's a lot of clinic. There are procedures, both, skin excisions like I talked about, Mohs, and also cosmetic procedures that you can get into. And then if you end up being interested in dermatopathology, you can do that when you're a board certified doctor as well. So, that's pretty much what dermatology is all about.
Nice. And so, would you say that, like, as a dermatologist resident, do you have time to do things you love, like, say, working out, or if you had a family, can you do those type of things?
Oh yeah, absolutely. I think dermatology, and this is of course my biased opinion, but I think dermatology is one of the best specialties in terms of giving you a lot of flexibility. So, you know, I think that in terms of hours of flexibility for your life, when you're on rotations or when you are in residency and working in clinic or in a hospital, those hours where you have to actually be at work, those hours, you're basically in someone else's control. The great thing about derm is that during residency and when you become an attending, you're basically at a clinic from 8 to 5, and those are the hours where you have to be somewhere. So anything outside of that, you really get to structure your time however you see fit. So whether it's working out, staying in shape, hanging out with friends, going on trips, or studying or doing research, you have the flexibility to do more of what you want and schedule your time appropriately, which I think in a lot of specialties where you have to spend more time in the hospital, it's difficult to do those things.
All right. Well, Dr. Mansouri, so what do you do with your free time? Is there any misses?
My free time, I spend a lot of free time with my puppy who's sitting over there staring at me. She may actually jump into my lap at some point. I have no idea what's going to happen. Um, I spend some time playing sports. So I grew up playing soccer, basketball. We have a group of guys that actually goes down and we play basketball every Thursday night. And then Friday I show up to work with like an aching back and legs and everything, but it's definitely worth it.
Happens when you get old,
I try
right?
to work out. Huh?
I said it happens when you get old, right?
It does. It happens with all those birthdays, man. Those birthdays, they pile up, and it just, it's not the way it used to be. You know what I mean?
Yeah, that's right.
And yeah, I have a sister that lives pretty close to me, and she just had a baby, so now I have a nephew to go see every once in a while. So yeah, that's pretty much how I spend my time.
Oh, that's great. All right, so what would you say is the most rewarding part of your job?
Well, I think one of the great parts of dermatology is that, like I was describing before, there are a lot of ways in which you can help patients. So both from the medical side and from the surgical side. So what I've really had a lot of pleasure doing is one, I've worked a lot with psoriasis patients. So for about 2.5 years, I did a research fellowship specifically in psoriasis, and we were doing a lot of drug trials for new medications that were coming out, and a lot of them are on the market now. Um, and it was just really nice to see a lot of patients who had sort of given up on their skin disease and thought that they were just going to have to live with sort of, itching and feeling, deformed or feeling like an outsider, and then sort of helping them with just, a medication or helping them along in their journey and getting them better and seeing the change that it can make in their life. I feel like that would be rewarding for anyone to do, and certainly in dermatology, from the medical side, you have that ability. And then from the surgical side, I've had a lot of fun doing Mohs surgery, because basically you have patients who have a skin cancer like on their face, and they're like, how are we going to remove this thing and keep everything symmetric and looking normal? And a lot of what we do is sort of a leap of faith for patients, because they're sort of putting their health and their well-being in your hands, and when you can do things to help them out and sort of guide them through this journey, it makes you feel good, but it also makes the patient feel good when they can sort of trust you in that journey as well. So
Yeah, that sounds absolutely incredible that you're able to help fix something that someone has to deal with on an everyday basis. And from what it sounds like, a lot of people feel like they've lost hope that this skin disease or whatever it may be may never go away. And then you've been able to help get rid of that and help them live a better lifestyle. And I think that's just so incredible.
yeah,
So,
yeah.
what would you say would be maybe the least rewarding or a part of the job that isn't as great as all the others?
Isn't as great as I mean, to me, dermatology is the way to go in medicine. Again, that's my biased opinion. Specific things, honestly, I have no complaints.
Wow.
I would advise anyone who's in medical school thinking that they don't know what they are interested in to definitely look into dermatology, because I know it's difficult when you're in med school to have exposure to all of the specialties, but I would certainly advise you to look into dermatology, particularly if you like clinic and if you like procedures.
Okay, well, great. Well, Bobby, you seem like someone that is, very satisfied with where you're at. You love your job. You love being a dermatologist. But what would you say are some of your long-term goals? Do you have other things looking, say, 5, 10 years down the road? What are you looking at?
Yeah, so um, I guess I started doing research when I was really, really young. I did my first sort of summer research nerd program when before my senior year of high school, and I did research all during college and during med school. I continue to do research now, so I really see myself going into academic medicine, so teaching, research, stuff like that, really helping med students, residents sort of learn and come through the ranks. There are a minority of people who go into academic medicine. Most people, probably 90-95% of residents, end up going into private practice. And I think it takes all sorts of people to, go into all sorts of things. So probably 5 to 10 years from now, I see myself, hanging out with residents, med students, trying to teach them something and probably learning a lot more from them than they're learning from me.
Okay, well, Bobby, we are going to have to end here pretty soon, but do you have any last words or some advice that you'd like to give some people that are maybe wanting to pursue dermatology?
Yeah, I would say if you're planning to pursue dermatology, it's one of the most competitive specialties to get into. I would say to start planning early, meet people, be nice to people, be yourself, be genuinely interested. I think one of the mistakes a lot of medical students make is trying to choose a specialty they're interested in and then make their interests conform to that specialty. Whereas really the opposite should be true. You should be finding out what you're interested in terms of your genuine interests, and then finding which specialty best matches with that. I think for myself, I'll be completely honest. When I was going, when I was in med school, um, I thought derm was like the specialty of like pretty girls. Like all pretty girls go into dermatology, and that's sort of like the funny thing that everyone says about it. But what I should have been noticing is that dermatology is a lot of clinic, it's a lot of internal medicine, and you have a good mix of procedures as well. And, I really always enjoyed being in clinic, and I did also enjoy being able to sort of split up my day doing different types of things because I thought it kept me more interested. So I think really just trying to be true to yourself when you're in med school and keeping an open mind is the best way to go about it.
All right. Well, everyone, you just heard from the one and only Dr. Mansouri, a dermatologist from down in Texas. He's going to actually be staying with us for a couple different episodes that we're going to be doing. He's going to teach us about how to get into residency, how to go about doing research. He's going to teach us all kinds of stuff. Okay, guys, so make sure you stay tuned. Make sure you follow him on Instagram. Get in contact with him. I'm sure he'd love to help out if you guys had any more questions whatsoever. All right, guys, so the one and only Dr. Mansouri. Thank you so much, Bobby. Woo
Thank you, Tommy. Good
woo!
seeing you.
Wow, that's a pretty big difference from radiology to dermatology. What made you kind of change that up?
What'd you say?
I Awesome. Okay, so can you hear me now?
I can hear you now.
Okay, perfect. So, Bobby, could you tell us what?
And you stopped.
Oh gosh. Okay.